Welcome back. Republicans in the House could hold their first vote on the repeal of the president's health care reform bill by the end of the week. It's not expected to get too far beyond the House, but our next guest is so opposed to the reforms that he's passed up government-offered insurance for himself and his wife. Joe Walsh is the congressman-elect from Illinois' 8th Congressional District, north of Chicago. He joins us live this morning in our Washington bureau. Incoming Congressman Walsh, thanks for joining us this morning.
Thank you, Jim.
And we'll talk about your personal situation and why you're foregoing federal health insurance for you and your wife in just a moment. But let's talk first about this effort to repeal health care reform. Do you think it's going to succeed? Because, you know, they're basically saying in Washington right now that there's just no way that the Senate will pass it. It's still in Democratic hands. And there's really no way the president's going to sign this. So is this just a symbolic move?
It's a big part of why we were sent to Washington. I know that I and a lot of my fellow freshmen ran on repealing Obamacare. The folks in my district told me month after month that they wanted this thing repealed. This is an example of the Republicans very seriously following up on what we said we were going to do. So, I mean, most importantly, it's why we were sent here.
Yeah, and let's talk about this decision that you've made. You've decided to forego congressional health insurance. As most Americans know, the perks are pretty good in Washington for members of Congress. And your wife, from what we understand, has a pre-existing condition. And so this will essentially affect her health care. Tell us about this decision. Why'd you make it?
Well, and again, importantly, Jim, this was a pledge that I made almost a year ago, last January, during the primary election, when Congress was attempting to exempt themselves from Obamacare. I didn't think that was right, and I think a lot of Americans didn't think that was right. Look, I don't want to burden, and I know it's not a huge number, but I don't want to burden the American taxpayer with my health care bill. The federal government is my employer. Right now, the health care system has a real bias against folks who need to shop out there in the individual market. My wife and I now are going to have to go through the struggles that a lot of Americans go through, trying to find insurance in the individual market and having to deal with problems of pre-existing conditions.
And do you think your fellow members of Congress who do accept federal health benefits are being hypocritical?
No, you know what? This is my decision. I believe there are a couple other freshmen that feel the same way. I just feel I feel I was sent to Washington to be something different. I think that folks out there are tired of people in both parties who for too long haven't experienced what most Americans go through. We tend to pass laws that impact the rest of us, but not members of Congress. There's going to be a real serious, I think, change in culture here in Washington. This freshman class, Jim, we're coming here to just conduct real business.
Right.
There are a lot of folks like me.
Sure, and you mentioned earlier that you and your wife will have to go out on the open market and buy health insurance like a lot of Americans out there. Democrats will argue that that's the whole reason why they passed health care reform. It's because many Americans who go out on the open market, people who have pre-existing conditions, have been shut out of that marketplace in the past. Aren't you subjecting yourself to the very system that has really put a lot of Americans in a financial bind?
Well, and you're right, Jim, but again, the argument here, the debate here is their solutions with Obamacare will make this situation even worse. That's what we ran on. That's what the American people elected us on. Look,
let's be specific. What exactly in the bill do you have a problem with?
Virtually the entire bill. And most importantly, Jim, it's this. This bill is a job killer. Small business right now in this country is scared to death of the costs, and they don't even know the full costs of Obamacare. Republicans very quietly and very seriously want to set about the task of putting Americans back to work. One of the first strong signals we can send is repealing Obamacare.
And Mr. Walsh, let me ask you, because this issue of pre-existing conditions has come up in the polls, and many Americans say that they like that particular aspect of the bill, that it would ban companies from essentially denying coverage to people with pre-existing conditions and folks like that. So what would you do with those millions of Americans who can't get health insurance because of that issue? And, I mean, are they just supposed to go to the emergency room? Are they supposed to rely on charity? Where do they go?
No, what we need to do, Jim, again, and it's a change in mindset, we need to free up private insurance of the numerous mandates and regulations they're under right now that make it so difficult to deal with things like pre-existing conditions. What we don't want to do in this country is ever get to the point where individuals can get sick, can have an illness, and then purchase insurance. We don't do that with auto insurance. We need to make sure that there still is a system in this country where folks are paying monthly premiums. We just don't want to get into a system where people can purchase insurance and then drop insurance whenever they want to. That's not going to help the system at all.
And I have to wrap this up, but just very, very briefly, to those people in your district who might say, boy, that's kind of cold to not accept health benefits through the federal government when your wife has a pre-existing condition, you would say what? Just very briefly.
Look, this is an important principle. My wife and I are going to struggle a little bit because of it, but I was sent to Washington to do what I said I was going to do, and this is a pledge I've had out there for a year.
Okay. Well, Congressman Walsh, thanks for coming on this morning and talking about your position, and good luck in Washington.